During the normal course of your working day, you won't need to wear personal protective equipment, or PPE. When you're vacuuming, cleaning with the non-chemical system, or dusting, your uniform and a regular hand hygiene routine are the most effective barriers against contamination. However, there will be times when you will need one or more type of personal protective equipment. What is personal protective equipment? There are 4 types of personal protective equipment: mask, goggles, gloves, and apron. When will you need to wear it? If you're likely to be working with chemicals, blood, or bodily fluids, you'll need to wear one or more type of PPE. Before you decide if you need to wear any of these, you need to carry out a risk assessment. Ask yourself, or, if you need extra information, ask your supervisor, are you going to be exposed to chemicals? Are you going to be exposed to blood or bodily fluids? If the answer is no, you should not wear PPE, but continue your usual hygiene practices throughout your work as normal. If the answer is yes, you will need to wear PPE and decide which type of PPE you'll need. If you might be splashed in the face, eyes, or mouth, you'll need face protection, a mask, goggles, or both. If your body is likely to be exposed, you'll need an apron and gloves. If your hands are likely to be exposed, using a cream cleaner for example, you'll need gloves. Of course, there will be times when you'll need a combination of PPE, such as apron and gloves. For example, if you're cleaning high surfaces and rails with a chemical or chlorine solution, you'll need to wear mask, apron, gloves, and goggles. Also, mask, apron, and gloves. Sometimes a ward will contain patients with infections that require staff to wear a mask. The nurse in charge will inform you when this is the case. Putting on personal protective equipment. When you use any type of PPE, you must put it on in the right order. This is to keep the risk of contamination to a minimum. The order for putting on PPE is apron, mask, goggles, gloves. Remember to clean your hands with alcohol hand rub or soap and water before you put PPE on. Follow the right technique for putting on each type of equipment. To put on an apron, pull it over your head and fasten at the back of your waist. To put on a mask, secure the ties or elastic bands at the middle of your head and neck. Fit the flexible band to your nose bridge, then fit snug to your face and below your chin. To put goggles on, put them over your face and eyes and adjust them to fit. When putting gloves on, make sure they are extended to cover your wrists. You should take off personal protective equipment in the right order too. This is to minimize the risk of cross-contamination. The order for taking off PPE is gloves, apron, goggles, mask. Follow the right technique for taking off each type of equipment. To take gloves off, grasp the outside of the glove with the opposite gloved hand and peel off. Hold the removed glove in your gloved hand. Slide the fingers of your ungloved hand under the remaining glove at the wrist. Peel the second glove off over the first glove. Discard the gloves straight away in a lined waste bin. To take an apron off, unfasten or break the ties. Pull the apron away from your neck and shoulders, lifting it over your head and touching the inside only. Fold or roll the apron into a bundle and discard straight away in a lined waste bin. To take goggles off, handle them only by the headband or the sides. If appropriate, dispose of the goggles or screen straight away in a lined waste bin. To take a mask off, you must clean your hands first to reduce the risk of contamination. Then unfasten the ties, first the bottom, then the top. Pull the mask away from your face without touching the front of the mask. Discard the mask straight away in a lined waste bin. It's very important to clean your hands using alcohol hand rub or soap and water as appropriate, and with the correct technique immediately after taking off all personal protective equipment. All personal protective equipment should be removed before leaving the area and disposed of as clinical or infectious waste. Always make sure you use safe working practices to protect yourself and help prevent the spread of infection. Remember, always keep your hands away from your face. Only touch the surfaces you need to. Change your gloves when they are torn or heavily contaminated. Regularly clean your hands using the correct technique. Remember, you only need to wear PPE when you're going to come into contact with blood, bodily fluids, or chemicals. So, when you're vacuuming, cleaning with microfiber cloths or dusting, your uniform and a regular hand hygiene routine are effective barriers against contamination, so you do not need to wear PPE.